Can you correct a deep bite with orthodontic clear liners such as Invisalign or any of the clear liner products? So this is a very common question, and this is what a deep bite looks like. It's an excessive overlap of the upper teeth of the lower teeth. And to answer your questions, if you can treat this with the liners, it's a little bit more complex than that, so let's talk about it. So it really comes down to two things. One is the skeletal deep bite, which we measure by FMA, Frankfurt horizontal to mandibular plane. If the FMA is smaller than 20, then it becomes very difficult to correct the deep bite with just the liners or just braces, because the skeletal relationship of the maxilla and the mandible is very parallel. So the patient has a very deep skeletal deep bite, which is very difficult to compensate for that with just braces or with just the liners. So the first thing I would check is what's the patient's FMA, Frankfurt horizontal to mandibular plane. If that's smaller than 19, it's definitely going to be extremely difficult to correct the deep bite with just braces or just with the liners. Now let's assume the patient's FMA is more than 20. Then the next question comes down to the deep curve of Spee. So the deep curve of Spee is just basically the lower arch looking like a hammock. If a patient has a deep curve of Spee, they are going to have a deep bite. But the nice thing about that is you can flatten a deep curve of Spee by intruding the lower anteriors, and that's going to improve and correct your deep bite, for example, in this case. If you look here, this patient had a deep bite to start with and did not have a deep skeletal deep bite, which is low FMA. And after they had the Invisalign treatment, this is what they look like. You can see on the bottom picture that the deep bite is corrected very nicely, because what they did is actually they flattened the curve of Spee and intruded the lower anterior teeth, and that's what's corrected the deep bite. Now, how do we correct the deep bite? All you have to do is just do some bite ramps on the lower anterior teeth and flatten the curve of Spee, intruding the lower anterior teeth. But it's very important that you don't intrude the posterior teeth, because that's actually going to make the deep bite worse. And here comes the problem with aligners. Aligners tend to be lower posterior teeth intrusive, because the patient has a trait that they're biting on. So what can happen if you're not careful, you can actually intrude the posterior teeth instead of the anterior teeth, and you will make the deep bite actually worse. So what I would do is when you set up your CleanChop, what you want to do is not intrude the posterior teeth, but only intrude the anterior teeth, and check for the deep curve of Spee, which you can very easily see on the Ceph, because the lower arch will kind of look like a hammock. So hopefully this helps. If you need help treatment planning your case, my link is in my bio. I offer treatment planning services for basically doctors, pedodontists, as well as orthodontists, orthodontic residents. If you get stuck with a case, you can upload all the case files, and I will help you sort it out and help you correct the deep bite in these cases, which is a lot more aesthetic once you correct the deep bite, because you can see both of the teeth on both of the arches.